Hello, welcome. Thank you for joining our presentation this afternoon. My name is George, living here on the border. I'll go by George or Jorge, either one is just fine. Thank you for attending this afternoon our presentation. Today we're covering Medicare basics. It's an educational seminar to help you understand your Medicare options and to see what's the best fit for your situation. We all have different situations, and so I want to help you decide what is best for you. And so let's talk about different options today. If you have any questions, please let me know. You have my contact information in the folder, and we can discuss it after the meeting. We can discuss it now. We can discuss it at an appointment. Absolutely, I'm here to help. And again, thank you for joining today. So let's go ahead and get started. What are we covering today? So today we'll be looking at enrolling in Medicare. How do you do that? How do you enroll in Medicare in the first place? The exposures of Medicare. So being in Medicare, what exposures does that provide for an individual? We're looking at the Medicare Savings Program. We're going to look at that. You've probably heard something about that. We're going to take a look at the Savings Program. And we're going to look at your Medicare choices. So once you're getting close to Medicare, you have Medicare, what choices do you have? What is going to be best for you? So let's start looking at that way. So we're going to go ahead and start with Medicare, original Medicare. So how does one obtain Medicare? Well, first of all, you have to have worked a minimum of 10 years and accumulated 40 quarters according to Medicare guidelines. So if you're working 10 years, it's very likely you reach those 40 quarters and you will be eligible for Medicare. So when do you get Medicare? You get it at 65, when you're turning 65. So that's key, because a lot of individuals will ask or think that because they're perhaps retiring at 62, or because they're receiving their Social Security check at 62, then they figure that they're going to start with Medicare at 62. And so no, the government starts Medicare at 65. Now, also, if a person is on disability, if they're receiving a disability Social Security check, then once that disability payment starts, that individual will get Medicare 2 years down the line, 24 months later. So if a person has a disability, then they can or will get Medicare down the line. If you're coming off your group coverage, and we're going to touch on that a little bit here today, where if you're still on your group plan and you're going to come off that group plan, that is an opportunity to obtain Medicare at that time. We'll look at that here shortly. End-stage renal disease used to be a circumstance where you would not be able to get certain plans, but that's changed now, so it's available for individuals. So then how does one enroll in Medicare? Well, a few ways. We have a website. We have here a website that you can go to and see about getting Medicare, signing up for Medicare. You can call them directly, 1-800-MEDICARE number, or you can call the Social Security hotline number, and that'll give you some information on how to apply for Medicare. So these are the options on enrolling in Medicare. So let's take a look at when that is. So these are your options. If you are on Social Security, you will automatically be enrolled in Medicare, Parts A and B, if you're on Social Security already. So remember, we talked about how some individuals will start with their Social Security check at age 62. Great. Once they hit 65, they will be receiving their their Medicare card, because they're already on Social Security. They're already receiving a Social Security check. if an individual is not receiving the Social Security check, then they have to apply. And it goes back to the slide we just showed you, how to apply. So if an individual, if you are not receiving a Social Security check, then you want to go and apply for Social Security 3 months before your Social Security starts. You can sign up for it online on the website. Signing up for Medicare on the website is fairly quick, 10 minutes there it says. And you want to apply 3 months before your birth month, 3 months before you hit 65. So that's when you want to apply for Medicare. Again, if you are not receiving a Social Security check, yes, the idea is to apply. If you already are, then it should come automatically. And I've seen instances where an individual will receive their Medicare card up to 3, 4, 5 months before their birth month. So if you're getting the check, it's going to be automatic. So now let's look at individuals that are working. Okay, so if you are still working, more importantly, if you are receiving a medical plan through work, so if you're covered through work for a medical plan, then you have the option where you can enroll in Part A, but not enroll in Part B. So the key to that is you should be in a group plan. You should already have insurance. And we're going to talk about that a little bit. Compare your group plan to your Medicare options. But one option is that if you are in a group plan, and if it's a really good plan, comparatively speaking, then the idea is you don't have to get Part B because you already have that group plan. And that's the idea. Now, if you do not have a group plan, then absolutely you're looking at Part B. So if you have a group plan, and if you decide to enroll in Part B, then you're looking at your group plan, and you're looking at your Part B Medicare. That's another premium, and so you can compare. If that's the way you want to go, great. We can talk about that. But just to let you know, with a group plan and with Medicare, there will be 2 premiums. Okay, we're going to discuss that a little bit. So things to consider when you have a group plan and you have Medicare, right? So one thing to look at is the premium. Like I mentioned, if you have Medicare, there's a premium for Part B, and your group plan, there might be a premium. Okay? Compare the deductibles. What's the deductible with your group plan versus with your Medicare? Co-insurance, the max out-of-pocket, co-payments. So again, compare both plans to see which provides a better option for you and your situation. Compare your group plan versus your Medicare options in your Medicare plan. So that's for individuals that are working, that they do have a group plan from work. Also, before I forget, there is a new Medicare card. They redesigned it. Basically, the big change is that it no longer has the Social Security number. That's been taken away, and it's been replaced by letters and numbers, a series of letters and numbers. And this is how the new card looks like. The federal government has instructed to destroy the old Medicare card because it's no longer valid, not going to work anymore, and destroy because it has a person's Social Security number, and in order to protect that number, it's best to destroy the card and this is the new Medicare health insurance card. If perhaps you haven't received it, it's a good idea to call Medicare. Again, the number is 1-800-MEDICARE, and simply request for a new Medicare card to be sent to you. And they will do that, and that's not a problem. But this is how the new card looks like. Again, no social security number, so that's the big difference in what they're doing there. So when does Medicare begin? When do you start with Medicare? If you're 3 months, 4 months away, and you're thinking, okay, many think that Medicare will start on their birth date. And Medicare does not do that. So it does not start on one's birthday. It generally starts on the first day of the month of your birth. In this example, if an individual was born on December 23rd, the effective date for Medicare would be December 1st. So the first of the month is when Medicare is going to start. Now, if somebody's birthday is on the first of the month, then Medicare will become effective the first of the previous month. This example of somebody that was born on December 1st, their Medicare will become effective on November 1st. So it's going to be the first of the month. And again, if your birth date is on the 1st, then you would start the month before on the 1st. So that's when Medicare would begin. Again, it doesn't begin on someone's birth date. It's going to start on the 1st of the month, and it'll be right there on the Medicare card. It'll say the effective date of when it begins, so it'll be on there. So you have your Medicare card, you got it maybe 3 or 4 months before, you applied for it and you received it, and on Medicare it says Part A. So what does that mean? What's the Part A? Well, the Part A applies to the hospital. And basically what happens there is because you've worked the 10 years or more, you got the 40 credits or more, then there is no premium on that Part A. So you've got the Part A, it's been paid for as the many years that you worked, and again, no premium on Part A. Now, if for whatever reason you did not work the 10 years or didn't make those 40 quarters, then the premium would be up to $471 a month to get Part A. And Part A helps with the hospital costs, and we'll go over those costs here in a little bit. Here we go. So what does Part A cover in the hospital? So we saw the premium. Now we can take a look at what it covers. Medicare by itself, Part A, will basically cover the first 60 days in a hospital, and the deductible for the individual, so what you'd have to pay, is $1,484 this year in 2021. That's the figure. And that deductible of $1,484 would help cover 60 days in the hospital. Now, if an individual stays longer than 60 days, then that individual would pay $371 per day, day 61 to day 90. So $371. And so this is going over some of the Medicare exposure. This is some of the things that I'd like to help with to try and avoid this situation, because that's a lot, $371 a day. And then if somebody stays longer than 90 days, it's $742 per day, lifetime reserve days, which is a maximum of 60 days. And so this is an example of a Medicare exposure that I'd like to try and help cover, so help you avoid all this. And then we look at skilled nursing facilities. So under skilled nursing facilities, the first 20 days are at zero payments, zero copay. Now, if an individual is there longer than 20 days, then they're looking at $185 per day. This is another exposure that Medicare gives at $185 per day for skilled nursing facility care. And if it's more than 100 days, then the individual is responsible for all the costs, okay? The Medicare exposure, that's what we have there. So you have your card, we go over Part A, and then on your card you also have something that says Part B, right below Part A. So what's Part B? Part B is the medical side, the doctor side. And now Part B does have a premium. The premium for 2021 is $148.50. That's the premium for 2021. Okay? So this premium is basically taken out of your Social Security check. That's how the systems work. They tell you, okay, we're gonna get you Part B, and Part B has a premium of $148.50, and they deduct it from the Social Security check. And again, it may go up every year, and it's gone up every year a little bit, so it's not a fixed premium figure, it goes up every year. And basically the way Part B works is that Medicare pays the 80%, and the individual, you would pay 20%. So that's the Part B medical side. It has that premium, and it's 80-20 on that side. Now, that premium, going back to it, depends on your income or what was reported for your income 2 years ago. And so if 2 years ago, in this example 2019, if 2 years ago your income was individual 88,000 or less, then you'll pay that $148.50. If it's higher than that, then that premium is going to be higher. So the premium, again, it's not fixed immediately. It does depend on how much was reported income, how much was reported income in 2 years ago. So that's how the system works. And depending on that, it tells you how much an individual pays for the Part B. And so on the Part B, again, it's going to be withheld or withdrawn from the Social Security check. If an individual is not receiving a Social Security check, then they will bill directly. Now they do bill quarterly, so that's a heads up that if you receive a statement from Social Security and they're saying that you owe $400, close to $500, they're charging quarterly. So they're taking $148.50 times 3 and then charging you that amount. Now I have seen individuals that will contact Social Security and let them know they can only pay monthly, and they'll set it up that way. I have seen that happen, but you'll need to contact Social Security to get that confirmed or set up. So that's only if you are not receiving a Social Security check. If you're not, then yes, you need to pay directly or set it up so that they withdraw from the bank account. But if you are receiving a Social Security check, they're just going to withdraw it from right there. So that's Medicare, the Medicare exposures. And so let's start looking at some of your Medicare options. Okay? So the couple options that we're going to start with, that we're going to look at, we looked at original Medicare. And so on this side, you'll see that original Medicare, we covered A, we covered B, Part A and Part B. And so now let's look at what you can add to your Medicare. So your Medicare, in this case, in this option, Medicare is going to be primary. And the supplement, a Medicare supplement, is going to be secondary. So, and then we're also going to include the prescription drug plan, and let's look at that. Let's talk about that, how that works. So this is one option, because the other option we're going to look at is the Advantage plans. And so one option is the supplement plans, and then the other will be Advantage plans. So let's compare both options. Let's look at the supplement plans first and see what they'll offer. Now, on the supplement plan side, You can go to any hospital, any doctor, anywhere in the United States that accepts Medicare without being referred. So one of the advantages of a supplement plan is that you can use it nationwide. So if you travel a lot, that's a good option, right? If you travel a lot and you want to be able to see doctors anywhere in the country, as long as they'll take Medicare, you can go to that doctor, they'll charge Medicare, and then they'll charge the supplement plan second. So that's how basically that works. So that's the supplement when you're choosing doctors. So as far as supplements, there's a lot of different supplement plans to choose from. You can see there's plan A, B, C, D, F, G, K, L, M, N. So different plans to choose from depending on your situation to see which might be best. Now generally, the one that's recommended is plan G. That's the one that's generally recommended. And why is that? Well, for the most part, it's the plan that almost is almost identical to plan F, and we're going to cover those two plans, G and F. But right now, plan G is the one that's recommended. F, not anymore, and we're going to go over why here in a little bit. But G is the one. Why? Because you can see down the row, it has pretty much almost all yeses on what it covers and what it helps cover, right? From the co-insurance, the Part B co-insurance, hospice care, skilled nursing, the deductibles, except Part B, they'll cover all that. So let's take a closer look at G. So what is G being recommended so much? Well, basically because it covers 100% coverage minus the Part B deductible of is that 185? I think it's gone up to 203, so we'll update that one. But it covered everything but the Part B deductible. Okay, so that's what makes Plan G so popular, because it helps cover everything. So Medicare would pay first, this Plan G would pay second, and it would cover everything doctor and hospital related, minus that Part B deductible. Once you meet that deductible, then it's all covered. So that's what makes it popular. You know, so it covers the Part A deductible, the co-insurance, the Part B, that 20% is covered, the excess charge of 15%, that's covered. And a key to it also is that Plan G is the same plan with one company as with another. So all across the state, the plan is the same. It covers the same. So a Plan G is a Plan G is a Plan G. So then all you look at is the carriers, the company offering the Plan G, and comparing premiums. And find a carrier, a company, a premium that fits what you want, and you can sign up with that company. So the Plan G is the same across the state. No difference there. Now, I'm going to go back to that Plan F and let you know that what happened basically is that the federal government is no longer allowing newly eligible beneficiaries to get a supplement plan that covers that Part B deductible. So now F has to leave. But if you already have Plan F, that's the good news. If you already have Plan F, you can keep it. You don't have to get rid of it. You can keep it. That's not a problem. You can hold on to your Plan F. It's not a problem. This is only a rule for individuals new to Medicare, beginning January 1st, 2020. So that was last year. Now, the bad news is that everybody that is on Plan F, the premiums are likely to increase. The premiums will be increasing in Plan F down the line, little by little. Now, why is it increasing? Well, the idea basically is that individuals in Plan F are a fixed pool of individuals. And if medical costs go up in this fixed pool, there's no more members joining Plan F, then that pool is going to get pricier and pricier, and premiums are going to be going up. So, as an idea, as a solution, switch from your Plan F to your Plan G before the rates go a lot higher. As the pool stays the same or gets less healthy, let's say, then the premiums are just going to go up because medical claims will be getting higher. So a solution is switch over to a Plan G and have that and save premium that way. So that's the situation that's going on with a Plan F. Now, that's the supplement. So you'll also need a prescription drug plan. So remember, we're in the option where you have your Medicare card, you have the supplement plan, and now you need a prescription drug plan for medications. Because remember, Medicare does not pay prescription drug medication. It goes through a private company. And the supplement plans do not pay prescription drug medication. It has to be through a separate company and a separate plan. And so we're going to look at getting a Part D or a prescription drug plan. Now, the costs, again, basically, the premium for them, depend on, again, what was filed income 2 years ago. So, if an individual tax return was less, $88,000 or less, then basically you would pay whatever the premium is for that prescription drug plan. And if an individual reported higher income 2 years ago, then they're going to pay a higher premium for that prescription drug plan. So it depends on how much income was reported 2 years ago for the prescription drug plan. What we help you do is create a profile in Medicare.gov, so we can see which prescriptions you have, and we can see which plans have those prescriptions. And mostly it's done during the annual election period, October 15th to December 7th, or we can compare those prescriptions and see which plan maybe gives you a better deal for them. And it's important to review those prescriptions every year to see if there's another plan that may help you reduce costs or reduce premium on getting the prescription. Okay, so those are the prescription side. Let's see. So, what are the prescription drug stages? I did want to touch on this as well. So, you have your prescription plan. We figured out the premium that works for you. Now you have your plan. So, what are you looking at? And I will mention across the board, whether they're standalone prescription drug plans or Medicare Advantage plans with a prescription drug plan, they're basically working very similar all across the board. How do I mean by that? Well, first of all, sometimes they'll have an annual deductible, right? So that means that you have to pay that first before you can pay the regular co-pays on your prescriptions. So first you have to meet the annual deductible. Some plans will have one deductible, some plans will not have a deductible. So that's where you compare plans. Which plan has a deductible and which plan doesn't, to see which one fits your needs better. The next stage is the initial coverage. The initial coverage is basically what you pay for prescriptions. What is your initial coverage? Well, usually they do break up medication into 5 tiers, 6 sometimes. It depends on the plan. And so some of those tiers will be generics, some of those tiers will be brand name. And so you look up your medication. We help you if you'd like. Look up the medication and let you know, okay, which tier does that medication fall into? And so then how much is going to be your copay. So that's the initial stage, your copay, how much you're paying for it. Now, you start at 0 at the beginning of the year, January 1st, midnight, 0. Now, as you start getting medications or getting prescribed medications and start filling your medications, the total cost of the medications will begin to add up. And so what we're talking about is the total cost. We're not talking about what you pay. We're not talking about what the insurance pays. We're talking about the total overall cost of each medication starts to add up. And if throughout the year, sometime during the year, if that total cost reaches $4,130 in 2021, then that individual will go into the next stage, which is the coverage gap, also called the donut hole. So what happens there is that you're going to be paying 25% of the cost of generic and brand name medication. So basically, you pay 25% for each medication. Now, I'm going to go back to January 1st. Now I'm going to look at, beginning January 1st, the total cost that the individual pays. So what the individual is paying starts to add up there as well. And if that cost of what the individual is paying reaches $6,550, then they will be on to the last stage, which is the catastrophic coverage. And in that stage, you pay a small copay or co-insurance amount for the rest of the year. And then January 1st, it starts all over again. So those are the stages for the prescription drug plans. These are the same stages for all prescription drug plans, whether they're standalone or whether they're with an Advantage plan. Same stages, okay? Same stages. If you have questions on this, absolutely, please reach out to me and let me know. We can talk about it. We can talk about your situation. Now, let's talk about penalties. Once you have your Medicare card, the most important thing, or one of the most important things to do, is to obtain a prescription drug plan. Because if you don't obtain a prescription drug plan, you will get a penalty if you don't have one past the first 63 days. This penalty is basically it's calculated by multiplying 1% of the national base premium, which right now the national average premium is $33.06, times the number of months that you did not have the prescription drug plan. So this is a penalty that is there for life as long as you have that prescription drug plan. So that's why I say again, the most important thing I think you can do once you start with Medicare is to always have a prescription drug plan. That way you will avoid this penalty. Now, the prescription drug plan can be a plan by itself, or it can be a plan with a Medicare Advantage plan. Just have that prescription drug plan to avoid this penalty. So that's the Part D late enrollment penalty that you want to try and avoid. And so one of the main questions that I get is issues that I get from my members is that their prescriptions are very expensive. How can I lower my prescriptions? This is probably one of the main ways to lower prescriptions if you qualify. It's the Extra Help program from Social Security. This is a program from Social Security that helps pay some of the costs with prescription drugs. They help pay with the cost of premiums, deductibles, co-payments. It helps pay that. Doesn't pay everything, but it's a big help in paying most of those costs. So this is the Extra Help program. is for people with limited resources, limited income. So one should have to qualify for this program. But if one does, if you qualify, it's estimated to be worth about $5,000 a year. So $5,000 in savings if once you get that program, if you qualify for that program. Great program to try and apply. Okay, I tell individuals, let's try and apply. I'm not going to tell you don't qualify. I don't run the program. Let's try and apply. All right. So we took a look at the supplement plan, the prescription drug plan by itself. That was one option that we're looking at. Now we're going to look at a different option. We're going to look at the Advantage plans. And what do those offer for us on the Advantage plans? And the Advantage plan is also called the Part C. Same thing. Advantage plan Part C, the same thing. It combines Part A and Part B of Medicare. So it's a combination of both. And we're going to look at that it does, it may include prescription drug plans and have additional benefits that we're going to look at. So let's look at some of that information. So Medicare Advantage plans, again, also known as Part C, the same name. They're run by private insurance companies that are approved by and under contract with Medicare. So they're approved by and under contract with Medicare. The private insurance companies are with Medicare. It's an all-in-one alternative. Again, it combines Part A, the hospital, Part B, the doctor, and many times also includes the prescription drug plan. So it combines all in one. A lot of times here locally, the premiums are at zero. They have lower costs, lower out-of-pocket costs versus original Medicare. A lot of times they do not have deductibles, and also they do have a maximum out-of-pocket. That's important because it gives you a ceiling, a stopping point of getting charged. Compared to original Medicare, that does not have a maximum out-of-pocket. So you can keep getting charged and there is no stopping point. So that's why the maximum out-of-pocket is important, because that provides a stopping point of what you will get charged during a year. So it's very helpful that way. So what do Medicare Advantage plans cover? Almost everything that Medicare covers. Because they're under contract with Medicare, they cover almost everything that Medicare covers. Is covered with an Advantage plan. And one popular feature of the Advantage plans is that they offer extras. And this is a lot of what you're seeing on television, email, phone calls, advertisements to the house. They offer these extra benefits. So we're talking vision, hearing, dental, fitness program, transportations to doctor's offices, over-the-counter medications. All these extra benefits are offered through Advantage plans. I also want to point that Medicare does not offer these features. So original Medicare doesn't offer vision, hearing, dental, fitness programs, transportation, over-the-counter, and other benefits as well. The Medicare, original Medicare does not offer that. These are offered through a Medicare Advantage plan. So big difference there. That's what you're seeing a lot of the commercials, advertisements about. You can get more dental, transportation. They're talking about Advantage plans, and that's the option. One of the options that you have. So on the Advantage plan side, there's a lot of different options. There's HMOs, the Health Maintenance Organization plans, where basically there is a network, and you can only go to that network. And if you want to see a specialist, you will need a referral, more than likely. but the co-pays are generally lower versus the next option, the PPO, the Preferred Provider Organization. With the PPO, the co-pays are a little higher compared to the HMO, but the PPO says that you can go out of network. Now, if you go out of network, the co-pays will be a little higher, but it gives you that flexibility. So you don't have to stay in your network. You can see doctors outside of network, which is also helpful when traveling. You can go out of network with a doctor. And the PPO says that you do not need a referral to go see a specialist. Just make your appointment, go see the specialist, which makes it flexible to get a second, third, fourth, fifth opinion to find a doctor that will help with whatever condition you have. So that's the HMO and the PPO are the main types of Advantage plans. There's also private fee-for-service plans, where these are a type of Advantage plan where the doctor has to approve that plan every time you go see that doctor. A private fee-for-service plan. The HMO POS, the point of service plan, is a plan that allows you to see somebody out of network. So it's an HMO plan. Remember, the HMO, you have to stay in the network. But if it says POS, point of service, then that gives you a little bit of flexibility to see a provider outside the network. That's what that means. And then there's special needs plans. So special needs plans basically are for individuals that perhaps have both Medicare and Medicaid, that live in a nursing home, or that have chronic medical conditions. Special needs plans, those types of plans. The most popular plan that I've seen on the special needs plans is the dual eligible plans, and these are plans that are both for individuals that have both Medicare and Medicaid. The benefits are increased, and so an individual gets more out of these plans for vision, hearing, dental, those kinds of things with these dual plans, dual eligible, again, for people that have both Medicare and Medicaid. Now we're going to show you, and I think you have some of that in your material, the different amounts to qualify for Medicaid or the Medicare Savings Program. The amounts may increase every year, so these are not fixed figures. Every year they do change a little bit. And again, if your income or resources are maybe a little higher than these amounts, again, you know what? Give it a try and apply, right? I don't run the program. I am not going to say no. If you want to give it a try and apply, let's do it. So let the department, the state, decide and say, no, okay, well, we tried. They say yes, great, well, a lot more benefits. We talked about the extra help program earlier. If one qualifies, we qualify for this Medicare Savings Program, then it's very likely that you will qualify for that extra help program, which will help for the prescription drugs with medications. So that's very helpful. So, to qualify for the Qualified Medicare Beneficiary level, the QMB level, so these are different levels, not just one level, it's different levels. To qualify for this QMB level, the individual monthly income limit, $1,094. So that or under that. So if a person is making $400, $500, $600 a month, and I've seen them, they would qualify for this program. If it's a couple, the limit has to be under 1,472, and then the resource limit you'll see there, 7,970, and if it's a married couple, 11,960. Now, if you qualify for this QMB program, then that helps pay for the Part A, if there's any premiums there, and it'll have to pay for the Part B premium. It helps pay deductibles, co-insurance, co-payments. And so basically I have members that have a program like this, and basically they're paying zero co-payments for doctors' visits, hospital visits. That's the QMB program. Now, another level is the SLMB, which is the Specified Low Income Medicare Beneficiary. Now, to qualify for this level, you'll see that the incomes, the limits are a little higher. 1,308 for an individual. For a couple, 1,762. For the resource limits, 7,970, 11,960. To qualify for this level, the SLMB level. Now, this level, different from the previous level, is that this will only pay or help cover that Part B premium. So it's not going to help with co-payments, co-insurances, deductibles. No, it's only going to help pay that Part B premium. Very similar to the next stage, which is the QI level, the Qualified Individual Program. So under this level, you can see that the limits are a little higher to qualify. For an individual, 1,469. For a couple, 1,980. And then the resource limits are the same, 7,970, 11,960. And again, so this program only helps pay for the Part B premium, similar to the previous level, the SLMB. So this helps pay for the Part B premium. So again, that's why I say, give it a try and apply to see if you qualify for one of these programs, because they do have different income levels. Okay, so that is the program. I also want to give a shout out to our veterans. Thank you for all your service. And if you have the VA, to let you know that you do have that option. That if you're in the VA, if you have both Medicare Part A and Part B, you have an option of getting a Medicare plan that you can use outside of the VA. So you get the best of both worlds. You can go to the VA, get your health care and prescription drugs, great. But anytime you want to use a facility, a clinic outside of the VA, you can have an Advantage plan or a supplement plan, whatever suits you best, to use outside the VA. I have members that do just that, VA members that will do just that. They'll go to the VA, get what they need, and then once in a while they want to see a doctor outside the VA, and they have a plan to do that for them. So I can definitely help with that. We can help our veterans, absolutely. Now, we've talked about supplement plans, we've talked about Advantage plans, the two options that you have. I do want to say that you cannot have both of them at the same time. You can only have one or the other, okay? So, don't think you can have both. Government says no, it's one or the other. So you can have a supplement plan with a prescription drug plan, or you can have an Advantage plan. That includes a prescription drug plan a lot of the time. Now, in addition, once you select one of these two options, an addition that can help strengthen those plans and your situation is the hospital indemnity plan. What the hospital indemnity plan does is that it can help offset some of the payments for going to a hospital. Now, for example, we can look at the Advantage side. If you have an Advantage plan, usually you will have a co-payment to go to the hospital, and the co-payments can be anything from $100 a day to $300 or $400 a day, depending on the plan that you have. So in that example, if let's say your co-payment is $200 a day, and sometimes it's for 5 or 6 days, the idea of having this hospital indemnity plan is that once you return home, call your agent, make a claim, and the company will then send you a check reimbursing you basically for that $200 per day. So that's a way of protecting yourself and having that knowing that that income is going to be there if there is a hospital stay. So it's a great addition to your Medicare plan that'll help protect your income that way. Now, another one to look at is something that is sometimes difficult to discuss, but it's important to discuss: the cancer, heart attack, and stroke. Now, I'm going to go back because we had an example there that I just wanted to show you on the hospital indemnity plan. This is one example of a plan, and so you get an idea. Individual who's 64 years old, in this example, they want $300 per day on their plan. So $300 per day for a hospital stay, and for up to 5 days, will run them about $31 a month. At 64 years old, average more or less. Yeah, I've seen some lower, but the idea is let's meet. We can talk about that option and how much it would be. So the idea is protecting that income in case of a hospital stay. Hey, you've got a plan to help you out. Now, let's go back to the cancer, heart attack, and stroke program or plan, which again is a great addition to your plan, because sometimes there are gaps in medical coverage for prescriptions, treatments. Maybe we're talking hotel stays, different costs that maybe one doesn't anticipate if they're diagnosed with cancer, that a policy can help. Like for this example, we have a cancer policy that will offer a lump sum of $10,000. So cancer is detected, a claim is made, and they're sent a check for $10,000, which again helps offset some of the medical costs, right? We're talking maybe the prescription medication that can be expensive, maybe some treatments that may not be covered as much, or help pay any co-payments there, co-insurance, or again, maybe any travel that maybe has to be done with hotels, food, that $10,000 can help cover. In this example, it's about $41 for this cancer policy for $10,000 lump sum. Again, the idea is we can meet, we can look at the plan and arrive at one that meets your needs to help you with this situation. God willing, never has to be faced. Another one that's very popular is dental coverage. Now, we talked about it earlier, depending on the plan you have. Medicare, original Medicare, again, doesn't cover dental. And so this is something, if you have a supplement plan, it doesn't cover dental. And you have the Advantage plan, it may cover dental, but sometimes it's not enough. Sometimes you need an additional plan to help cover the dental. It's very popular. So there's different dental plans, different types, and so it's just a matter of which one fits you best. There's some that'll be from $27, up to $42 a month, depending on what you're looking for, depending on how much coverage you'd like to have in a dental plan. So different options that you have. A very popular plan that everybody likes to have, needs. Not a lot of dental coverage out there with some of these plans. This is a great way to add to your coverage, to your health needs. And so I'd like to thank you for joining me today and ask you to please consider giving me a call, meeting with you to help with your healthcare needs on the Medicare plans. We're a local agency here in El Paso, and we offer the majority of the plans here. I've been meeting with members, going over 12 years now. Thank God this business has been well for myself and my family, and so I like to take that thankfulness and show members how I can help them and help them as best I can with any questions that they have. I provide my cell phone number, my information. I do in-home appointments, met people at their homes or at the office, whatever works best for you. I'd like to be your agent all year long, not just right now, not just signing you up, but the entire year. I'd like to be able to be there for you throughout the year. At the end of the year, if you want to compare any plans or you want to review your coverages, and then continue on that way. I've been doing this for over 12 years, and again, very thankful that it's been put the food on the table, and I've been able to meet a lot of different people and being able to help many different people. We are independent. I'm independent. We have agents, and we are independent. So we work for you. I work for you, not an insurance company. I want to help you find the best plan for yourself that'll help your situation. And if that plan is not helping your situation anymore, let's take a look at a different plan that might fit your needs better. So I want to work for you. You'll see my contact information, social media information. Please reach out. Give me a call, a message, a tweet. There's so many different ways of communicating now, email, so forth. So please reach out, give me a call. Let's set a time to meet in person, by phone, by Zoom. Lots of ways to communicate now. Be glad to meet with you, see the situation you're at, and how I can help best with the situation. So again, thank you so much for meeting today, and I'll be following up with yourselves individually to answer any individual questions, and I look forward to speaking with you soon. Thank you.